Khaled, sorry about that, man. It's been a bit of a busy day.
I can imagine, yeah. I'm sure you're doing a back-to-back-to-back hit. So let's talk. I know I have you for a little bit. Appeal to close all businesses with 5 or more cases within a 14-day period, starting this Friday for 10 days. Is that correct?
That's correct. Of course, it wouldn't be all of them necessarily because we got to let businesses know and we got to maybe need to stagger it just given how many businesses are involved. But the order will come into effect on Friday, and basically we will start enforcing it, shortly after.
Okay, perfect. And then is there an essential business list that will be exempted?
Yeah, so essentially this workplace order is just an update to our previous workplace order. The reality is we're now getting to a phase in the pandemic where the variants are spreading faster and further in workplace. Rather than leave places open while we are in the course of investigating and really trying to, trying to nail down everything with the workplace open, we're sort of taking the same approach that we took with schools, right? Which is when you have a case in a school, you send folks home, then you do the investigation. That's kind of what we need to do because we're seeing with the variants in some of the workplace outbreaks we've had recently, it just spreads further and faster. It sickens more people, and it's just adding to the burden we're seeing in our community. So that's to the extent that that's what we're doing. The hope is that it'll help to at least bring this third wave under control in our community.
This exemption list, what's going to be on it? Grocery stores?
Yeah. So. Yeah, sorry, and I was trying to recall what the original question was because I realized I'd gotten off in a tangent as to why. We are really putting stuff that is critical to the health and well-being of our community as well as critical to the functioning of society. So it will include things like so things that will be exempt from full closures will be things like pharmacies, full, grocery stores, medical clinics, hospitals, as well as critical infrastructure, things like, utilities or shelters or transportation, that sort of stuff.
Okay. These outbreaks, businesses, are they going to be listed now on the Region Appeal website?
No, what we will be listing is if a workplace is closed,
Okay.
under the provisions of this expedited workplace closure, we will list which workplaces have been closed and on what date.
Okay, great. And sorry, why the change now? Why the change now to list the actual business when we're kind of 14 months in?
Well, so previously we would not. So typically we are not listing outbreaks for workplaces. It's not a change in our policy per se. So previously with our outbreaks, we were typically disclosing the sector as well as the number of cases. The issue is when you disclose the number of cases and you disclose the sector, if you start disclosing the name and the address, you're starting to get into identifiable information. In the case of a workplace closure, we're naming the workplace and the date of closure, but we are not going to be naming the number of cases. We're just going to say they met the threshold for closure. And so that takes it out of the realm of possibly identifiable. So for example, if you have a place that is closed and you say there's 5 cases and it turns out that there's 5 people that work there, you've basically told people what their medical condition, that's their diagnosis. So based on that threshold, it's now a case that if we get a workplace that has a certain, that meets the threshold, we will name it as closed, but we're not disclosing anything that could potentially identify someone's COVID status.
Okay. And will Amazon in Brampton be part of the exemption, or will they close?
I don't actually believe that I'd have to go back and double check with my team. There are over 100 workplace outbreaks that we're currently investigating, and then so some of them will presumably fall under the course of the provisions of the updated order.
Okay, perfect. And can you, we get a lot of people giving us information, and obviously some of it's hearsay. Can you confirm or deny that there was a COVID-19 outbreak in the Brampton Costco?
I wouldn't be able to at this point in time, and my team, as you know, just given our policy on disclosure, I actually plausibly don't have information on that at this point in time because my team keeps that confidential in respect of the people that in private. The previous disclosure policy that we have.
Okay. A lot of questions we got about the mobile vaccination clinic for 18 plus. When can we see this?
So, I mean, I think we're moving to implement it. Certainly the province announced it, and then they reached out to actually figure out what resources and what additional allocation we might be able to have. But I'm hoping that we'll be able to launch it before the end of the month.
End of the month? Okay, perfect. And then
that we've actually had mobile clinics. I mean, we've had mobile clinics since January. That's how we did all our long-term care in our retirement homes, and we've actually been continuing to do outreach to apartments and condos with lots of seniors. We also have a homebound program together with paramedics, and that whole program, our mobile program to date, has already delivered way over 10,000 doses to some of our most vulnerable and limited mobility residents. So this is not new. Pop-up and mobile clinics are things that we've been doing, but the recent provincial announcement allows us to expand that program to target hotspots in workplaces.
Okay, perfect. And then can you go against provincial orders in regards to opening up, outdoor amenities like, tennis courts, basketball courts, and golf? Can you do that?
I certainly struggled, as I think with many other people, around the announcements to close some of those outdoor amenities, to the extent that I'm trying to navigate a really severe third wave at this point in time. You've got a hospital that is on the verge of collapse, or two hospital systems that are just very much overflowing with COVID patients. I've got a buddy of mine who's an ICU doc from Sudbury, and he's come down with some of his colleagues. Like, they're pulling in docs and nurses from all over the province. They're shipping patients out all over the province just to keep afloat. So the situation is absolutely critical. We've got a stay-at-home order. We're trying to get people to stay at home. And so while I think the provincial decision to close outdoor amenities, maybe it wouldn't have been my first move, it is also, just from a messaging perspective, very challenging for me at this point in time to say, hey, we've got a crisis at hospitals, but by the way, you can use the golf course, kind of thing. Like, it's something that I'm still trying to figure out how best to navigate at this point in time.
Okay. I'm looking at what you ordered this morning. I got the press release at 5:30 in the morning. So somebody was up early. And it seems like you're being kind of a trailblazer to these closures, and it happened in Toronto. Has the government of Ontario let you down in regards to protecting, Peel?
No, I don't think so. I think, if anything, it's just we have different perspectives, right? The government of Ontario is making rules and policies for the entire province. And we have a vast and diverse province. I did part of my family medicine rotation in Kenora. I've lived in London. I've lived in Windsor. I've lived in Ottawa. So I've seen, many different parts of our great province. And I know that they all have different needs. They have a much more difficult job. I have an easy job. I am in one of the hardest hit regions that I'm privileged to serve in the province. And I ultimately have to make decisions that pertain to the transmission patterns and the health risks that I'm seeing in Peel. So I think that's essentially where the difference lies. I'm ultimately serving Peel, and ultimately trying to work with the provincial government as best I can to try to get us. I think we share the same goal. We're all trying to get out of this, right? So that's where we're going.
Yeah, and last thing, I'm going to be Team Astrazeneca in about 3 hours. As soon as it was over 40, I booked an appointment at a pharmacy in Streetsville. So, and the weird and kind of sad thing is that we put a poll up on Instagram Live, and 55% of people said they wouldn't get an AstraZeneca vaccine. What do you have to say to that?
Honestly, take the first vaccines that's offered to you. The faster we get first doses into arms, the faster we're going to get to community immunity, and the faster we're going to get out of this. So, Khaled, I'm glad you're going to go get your shot. I know that my parents-in-law, my parents, they all got AstraZeneca. Like, it's and I think the big thing I would share as well is, if you've ever taken a flight to Vancouver, your chance of getting a blood clot was higher on that flight than it was with getting an AstraZeneca shot. So. You can either get AstraZeneca and we can get out of this, or you can not get AstraZeneca, and when we get out of this, just make sure you don't take any flights to Vancouver.
Okay, cool. All right, Dr. Lowe, thank you so much. I know you have probably 30 more hits today, so take care.
Take care of yourself, man.
Yeah, take care.